Hello, everybody. I'm Dr. Alicia Clevenger. I'm coming to you from the Midwest in the United States. I'm excited to be here with you, whether it's the evening, the morning, to be able to share the details, the frequently asked questions about the products from 3 International. I have a very special guest here with me today. Dr. Dan Gubler is our guest. He is the Chief Science Officer and Product Formulator for 3 International. And he is going to deep dive with me into the products, some of the questions that we get asked. You know, the world of supplements it's a big industry with over 8,000 supplement companies out there, 150,000 supplements. It's a big world. And trying to navigate that can be hard for people and knowing what is out there and who to trust. And so when I was presented with these products and I learned about them, and I'm a science girl, I took a deep dive into the science. I knew that this was different than really anything else out there. As we come across people that learn about the products, we encounter questions, specific questions that people have that they would like to know, whether they pertain to their own individual situation or just in general from things they've learned. The world is full of information out there, whether you're on social media or whatever you're diving into reading. And so we just want to cut through some of that chaos for you to be able to know what these are, why they are so efficacious, why people are getting the amazing results they are. I want to share with you a little bit about Dr. Dan. He is Caltech trained PhD in organic chemistry, absolutely brilliant. He has over 1 million followers on social media. So if you don't follow him on social media, go give him a follow. Full of amazing information and really breaks down how to change your health in easy bits that make a huge difference, right? It doesn't have to be so complicated. He knows the complicated stuff and has really broken it down for us. He has over 70 formulations, 16 patents granted or pending, and he is absolutely the brilliant person behind the products here at 3. Dr. Dan, welcome.
Thank you, Dr. Alicia. So great to be with you.
I'm excited you're here. I want to share a little bit, but if you could start with sharing about your background and from your work in the pharmaceutical industry and the move over to the nutraceutical side and the supplement world and where that shift came from, because I think it's important for people to know.
Yeah, I'm an organic chemist. And what that means is I work with molecules, carbon, hydrogen, nitrogen, and oxygen, molecules from plants that are naturally occurring. And when I received my PhD at Colorado State University and then moved to Caltech, I worked on pharmaceuticals. I synthesized pharmaceutical drugs and I loved it. It was amazing. I loved making molecules that no one else had made before. I loved following in the footsteps of my grandfather, who was a biochemist and was part of a team that discovered vitamin B1, thiamine, and copper and their roles in the body. And it was amazing. I remember synthesizing a pharmaceutical drug for a company, and when I started to do that, they sent over a packet of information. And in that packet that I had never seen before when I was synthesizing other drugs was a research paper showing that there was a molecule from a plant that did the same thing as a drug I was trying to make. And for whatever reason, it just hit me like a ton of bricks, where I was like, what am I doing? I'm trying to synthesize a pharmaceutical drug. And as we all know, pharmaceutical drugs have side effects, sometimes some not so great side effects. And that's because they're unnatural. The body doesn't know how to metabolize them and break them down. And so for me, that was an aha moment. And from that moment on, I focused on dedicating my life to using natural molecules from plants that can do the same thing as pharmaceuticals in a more gentle, but also a proactive fashion, focusing on proactive wellness and long-term well care rather than focusing on when there's a huge problem and trying to figure out how to deal with that problem using a harsh reactive wellness method.
Great. That's amazing. And I think more and more people are becoming attuned to that, wanting that proactive wellness model, taking care of yourself now. And we live in a world where people have been taking care of their cars, taking care of their teeth, doing all these things, but actually taking care of their body was that reactive model. And so proactive health seems to be where people are at. They're wanting that longevity and they're wanting that life in their years. In general, here at 3, we have 6 supplements. So we have 6 supplements. We have a neurocosmetic line, and we have that clean energy drink. And those of you who are here today and you're thinking, I want to know all about those, we have so many videos. The person who invited you here can absolutely share those with you and you can deep dive into that part of the products. What we're doing today is that FAQ, the details, right? The details and the commonly asked questions that people get asked. Dr. Dan hit on it. That world is so complex. And one of the things that he has done through the curation and the absorption of these products, like where he pulls ingredients from and how he's put them together, that really is so complex, but he's made it simple for us. Simple for us to understand, simple products for us to take, knowing that extensively in the background, there's so much going on of what went into these. So we're going to just jump right in. I have some of my questions set. I feel like we're on a game show or something like that. Here we go. So one of the commonly questions we get is natural flavors. So can you tell us about natural flavors, what they mean in the world, and then what they also mean in context of our products?
Natural flavors in the supplement industry historically can be a place where you can slide in ingredients that you don't want people to know about. And the FDA and regulatory agencies, they haven't really come out against that, but it's a common trick of what contract manufacturers do when they're making a product. When we say natural flavors, it's exactly that. When you look at a spearmint flavor that comes from nature, when you eat mint, that flavor comes from a molecule called menthol. When you eat a strawberry, there's molecules called aldehydes that actually give that strawberry flavor. And so when we say natural flavors, it's exactly that. If it's a strawberry flavor, like our collagen product that's a strawberry flavor, we grab aldehydes from strawberry and we put them in the product to give the strawberry flavor. It's as simple as that. We never use natural ingredients as a place to hide ingredients, to cover up what we're doing. That's not who we are. We're 100% transparent in what we do. We're experts in curating and using molecules. And so we use natural molecules to give the flavor of our amazing products.
Awesome. When you talked about manufacturing, you led me right to my next question. That one of the things that shocked me, and I've been working with the supplement industry for a really long time as a chiropractor. One of the things that shocked me is that the manufacturing that goes on. Most companies don't disclose much about their manufacturing. Here at 3, that's open. We publicly release those certifications. And tell me more about that, like the world of manufacturing in general.
So there's about 8,000 supplement companies in the United States, and we might talk more about that in the future. But the crazy thing is that there's only about 150 to 200 manufacturers of those supplements. In the supplement industry, the big thing is if I want to develop a supplement, most people think, oh, well, you go to the lab and you do R&D. That's what we do here at 3. We have our own labs. We go to the benchtop and we make our products from scratch. Most supplement companies, they don't do that at all. What they do is they make a call to one of these 200 contract manufacturers and say, hey, I want a creatine product, or I want a keto product, or I want a collagen product. Let's talk about collagen. I want a collagen product. So they call them up and they say, hey, will you make a collagen product for me? Well, they will. And they say, absolutely, we'll make one for you. We'll send you samples. They send samples to you. You try it. You're like, oh, wow, this tastes delicious. Okay, let's go, make us 5,000 units of that. And we're on our way. And that's product development. Well, there's a few problems with that. Number one, a contract manufacturer wants to make that product as cheap as possible. So they're not using the latest technology. And even if they're trying to use the latest technology, they're manufacturers. They have no idea what the latest technology is in the science. They're not scientists. They're not formulators. They're business people and they're manufacturers. So they don't know what's going on. They try to, they're doing their best. They're not malicious, but they just use their best when it comes to ingredients. Vendors come by and said, hey, there's this really cool new collagen. You should try it. And, the vendors get kickbacks. There's all sorts of different things that go on when it comes to money and bonuses and stuff like that. So there's that at play. And so they do that. A manufacturer, they make money when it comes to volume. They don't make money when they sell 500 units of a product. They make money when they sell 5 million units of a product. And so they want to keep the formula simple. And most importantly, they want to keep the formulas cheap, very cheap. So they use really cheap ingredients and that's how they do things. And so when you get a product, a supplement, for most supplement companies, it's turnkey, meaning that a manufacturer makes that, they give it to you, they'll put your label on it. But the thing is, they make that same product for 50, 100, 500 other companies. And you can see that when you go to Amazon or online, or you go to the grocery store or a pharmacy and you look at the products. Have you noticed that most of them are the same? Most of the magnesium is the same type. When you look at, I don't know, a sleep product, it contains pretty much the same ingredients. Well, that backs up what we're saying, that they get it from the same contract manufacturer. And so manufacturers also, when it comes to quality testing, third-party testing, a little secret is they have their own testing company in-house and they call it a different name. And so when it comes to third-party testing, when they say it's third-party testing, it really isn't. They don't send it out to an independent lab. We send our products out to the best lab on the planet called Eurofins, and they independently test our products to make sure that the molecules and the ingredients we say are in our product are in our product.
That was something I've learned from you along the way was that so many companies that there's a wide variation of third-party testing, right? There's like high end and no end, right? And so, and the fact that we use that company really validates behind the products. In terms of manufacturing, we can just go back to that real quickly. You said that people are calling and doing that. What is different here? Like, what are you doing here? You're not taking you're not going out and doing that. You're out looking for things, right?
Yeah, so when it comes to supplement formulations, you need to obviously put ingredients in your formulation. And there's a couple of different ways to do that. You can get ingredients from vendors. So back to this collagen example we were talking about, there's companies that sell collagen products and sell collagen ingredients. And so they'll ask the contract manufacturer, "Hey, do you want to try a sample of this? And, will you use this in our formulations?" Well, what we do, for example, collagen, we collaborate directly with a company from Norway that makes the best collagen on the planet. We've worked with them, and this collagen is hydrolyzed, it's micronized, it's at a very small molecular weight. It's less than 1,000 Daltons, so it's absorbed in the body. Most collagen products, collagen's a big molecule, it's not absorbed. So what makes us different is we travel around the world studying and isolating new molecules from plants and other natural sources, and we put them in our formulations. So nobody else uses the molecules and the ingredients that we use in our formulations. And it makes sense that if you're using new molecules and new ingredients, and if you've shown that those new molecules and ingredients have special activity, for instance, they regulate epigenetics like our products do, then you have power. Your product is unique and it's powerful and it has advantages over other companies in the supplement space that just kind of use this turnkey system.
Yeah, absolutely. So that was a question, is the sourcing of the fish. So thank you for answering that, where it's from. But why 10 days with our collagen?
So, our collagen product, what makes it unique is our collagen source and the peptides that we use. A lot of people are talking about peptides and how that's all the rage right now. Well, we use peptides in our formulations. We use peptides in our skincare, our Visage line, and we also use peptides, obviously, in collagen. Our peptides are unique in that they contain a molecular sequence that actually teaches the body how to make collagen again. As we age, and we don't know exactly why, but we know 100% that as we age, collagen production in the body goes down. So the factories that produce collagen aren't producing as much. And that's why as we age, we see signs of aging. We see wrinkles, hyperpigmentation, age spots, and that's because collagen production is going down in the body. And so what we found is that this special type of collagen and also other molecules that we found, punicalagin from pomegranate and other molecules from nature, can actually turn those collagen producing genes back on. And that's why you take it 10 days, because when you take it those 10 days, you teach the body how to make collagen again, and it starts making its own collagen. And it's a lot better to do that because when the body makes its own collagen, it's natural, it's highly absorbed, it goes directly to where it should, it's optimized. Whereas if you're taking a collagen supplement that's turnkey from a manufacturer, number one, as I mentioned before, collagen is so big it can't get into the body. And number two, even if you're getting some collagen, the body's constantly depleting collagen. So you're never really keeping up with the flow of what the body needs. So that's why our product is unique. That's why it's special. And that's why you take it for 10 days.
Yeah, that's awesome. All right, here we go. Are the products organic? And how do we think about sourcing and quality behind the organic label? Like what sourcing standards do we follow that might be even higher than organic? So let's talk about that.
We use organic ingredients when we can. And just to help people understand, well, what does organic mean? What organic means is when we're growing crops in the agricultural business, you need to keep pests off of the crops, obviously, or else you're not going to have a good harvest. And so there's two different ways of doing that. You can use conventional methods, and conventional methods are you use pesticide sprays, glyphosate, Roundup, different things like that. The other method is organic. And organic uses traps and different things in order to catch the pests. However, organic crops are still sprayed with pesticides. The difference is that there are different pesticides that have been shown to be overall a bit safer than conventional pesticides, but they're still sprayed with pesticides. What we do is we take it a step further and we try to use with our discovery and discovering new molecules from plants, we try, if we can, to not use any pesticides at all due to our unique extraction methods from what we do. Now, when we need to use pesticide techniques, we use organic when we can. The thing, though, and the most important thing that we do is through our curation technology, when you get a product, there's no pesticide residues in there at all. And that's
Because
an important thing to know because when you use supplements, if they're saying this is an organic supplement, it still has pesticide residues on it. And even though it's organic, it still might have negative health consequences.
But because of the certifications that you've put into the manufacturers, you can say there's no pesticide residue on ours, which is really beyond that organic.
Exactly.
Got it. That's awesome. Okay, let's move on. 3 has products listed in the PDR, the physician's desk reference. What does this mean? Why is this important in the healthcare world? And then the number one question I get is, can supplement companies pay to be in the PDR?
Fantastic questions. So the PDR, the physician's desk reference, recently they rebranded, they call it the prescriber's digital reference because they changed it used to be in a book. And actually my computer is on the PDR book. I'm using it to prop it up, but this is the physician's desk reference here. And it's a huge book. It's really thick and it contains pharmaceutical drugs and it contains a few supplements from supplement companies. And the way it works is the PDR was developed to be a reference, a resource for doctors. And doctors need resources. Doctors aren't experts when it comes to supplements. That's a whole other topic. But when it comes to proactive wellness, doctors really don't know a lot. I was talking with my brother-in-law, who's an anesthesiologist, board certified anesthesiologist, and I was asking him how many classes he took in his medical school, his residency, his 12 years of training that talked about supplements and proactive wellness. He said he took one, and the class met once a week, and it was actually a pass-fail class. There was no letter grade associated with it. So he said that a lot of his medical student, his colleagues, they didn't show up to the class really at all. So
Why
isn't
would
that interesting?
college students, right?
Well, yeah, right. Medical doctors, they don't have a lot of training in this, but they need help. And so they have a lot of resources. If you notice when you go and see a doctor, and I remember I have 3 daughters, and when they were young, I would take them in when they had an ear infection or something like that, a fever. They were really grumpy, right? Yeah, 18-month-old, 2-year-old, take them into the doctor's office. They're grumpy, they're crying, they're upset. You go see the doctor, and the nurse comes in and tries to get the vitals of your 18-month-old, and that doesn't work very well. They're fussy and whatnot, but you get it. And then the nurse gets it, and then the doctor comes in, and the doctor asks some questions. They look at the vitals that the nurse took, and they ask some questions. And then just when you think they're going to actually help your child, they leave the room. They're like, I'll be back in a minute. And I was like, why are you leaving the room? Do you need to go check your fantasy sports scores? Do you need to use a restroom? Is it lunchtime? And it doesn't matter if I brought my daughter in at 9 a.m. or 1 p.m. or 4 p.m., they would always do that. Well, what they're doing when they leave for that 5, 10, 15 minutes is they're looking at resources. They're looking at the different vitals. They're trying to figure out, what is the most likely, based on the symptoms, what is the most likely diagnosis? And then, most importantly, they're trying to figure out what to do and how to help their patients. And so they look at databases and resources. And one of the premier databases that they pretty much always look at is a prescriber's digital reference or the PDR. because the PDR lists thousands of pharmaceutical drugs. And what's really cool is it also lists some proactive wellness measures, some supplements. And we're really proud that our foundational products, what we call the Simple Six, our six products, all of those are listed in the PDR. So isn't it really cool when a medical professional is looking at something, when it comes to foundational health and wellness, in addition to classic multivitamins that are listed, our Vitalite product is in there as well. And isn't it cool that when doctors look at something to help to support a healthy inflammatory status in the body, not only are there pharmaceutical and OTC anti-inflammatories, but our Revive product is in there. And so we're really proud. We're one of about 30 supplement companies to have our products in the PDR. And what's even more interesting, and going back to your last question, Dr. Alicia, about, well, why can't you just, can you buy your way into the PDR? Can't you just pay money? Well, let's think about this. There's 8,000 supplement companies in the United States, and 30 of them have products in the prescriber's digital reference of PDR. And let's just think about that. So if all you had to do was pay some money, and supplement companies, some of these are making a lot of money every single year. If all you had to do was pay, $5,000, $20,000 a product, I mean, that's nothing. They would pay that. If there's 8,000 supplement companies, you would think that at least there'd be one, two, three, 4,000 companies in the PDR, right? If all you had to do is pay money. Well, you can't, because you can't buy your way into the PDR. There's a subscription fee. Once the PDR has accepted your product, you do pay a maintenance fee for them to upkeep and to have that product in their database, but you can't just buy your way in. Why? Because the prescriber's digital reference is very particular on what products they let in, because these products are meant to help medical practitioners. So it needs to be useful for medical practitioners, number one. It needs to have clinical studies, validation behind it. It can't just be, if you're grabbing a turnkey product from a manufacturer that 1,000 other companies have, that's not going to get into the PDR. You have to have novel, unique science, and you need to show that that product actually works.
Yeah.
And here at 3, our products check all of those boxes, and that's why they're in the PDR. And it's not easy. When you submit a product to the PDR, there's a vetting process where they actually come back to you and they ask for clinical studies, they ask for data, you submit that to them, they come back, and it's an iterative process where sometimes they ask you 4, 5, 6 times to provide data in order to get something in the PDR. And it's not always a slam dunk. I've submitted formulations to the PDR that have been rejected, that they're like, this just doesn't, it's not a good fit for the PDR.
Right. And it's been around a long time. I mean, it's an 80-year-old thing. Like it wasn't invented, they didn't come out with it in 2020. It's been around since like 1945. So to think about that, there's only 30 supplement companies in there and it's been around since 1945. That's a really big deal. So yeah, I really think that speaks volumes. So, okay. Let's go to proprietary blends. Why does 3 use proprietary blends, and how does that protect both the science and the consumer?
Proprietary blends are something that a lot of people talk about. And when it comes to natural flavors and the perception, with so many people sharing different things on social media, and supplement companies share a lot of different things in order to try to position their supplements above others, and they use marketing tactics and strategies. So another thing is proprietary blends. That proprietary blends are bad. That people are using that to take advantage and to make an inferior formula. And just like natural flavors, that is true. It can be true. Companies use proprietary blends to make their supplements look really cool, where if they say we have a proprietary blend of 10 ingredients, and that top ingredient, the first ingredient is, 490 milligrams, and the other 9 ingredients are less than 1 milligram, that's pixie dusting, fairy dusting. And that happens, and that's not great. What we do here at 3, we are molecular experts, like I mentioned before. We isolate new medicinal molecules from plants all around the world, and we put them in our formulations. That's what gives us a unique approach. And this is called our curation approach. And because of that, in order to make our supplements unique and powerful and beneficial to the user, and beneficial, if you're using 3 as a way to make some money to support you and your family and to help other people, uh, to make money as a business for you, that's why we use proprietary blends, where we keep this amount of the ingredients, we keep it a secret. And we keep the actual molecules that we use a secret because if we were to disclose that, then everybody would know our formulations. So that's why we do that. Has nothing to do with pixie dusting, fairy dusting. It has everything to do with making the best products in the industry so that they have unique power and efficacy.
Yeah, I don't want anybody stealing that eternal recipe at all,
Yeah,
right?
that's right.
Okay.
That's right.
Um, so okay, let's talk some ingredients. So this is a common question. So some ingredients, when you look at them, look lower than what maybe a recommendation is. Or somebody might say, this only has this IU or this many milligrams. So we can talk about that with formulation and our absorption impact with the products and just that in general, because I think there's a lot of misunderstandings about recommended dosages.
So with recommended dosages and the ingredient amounts that we use here in our formulations at 3, there's two different things we need to understand. Number one is the dosage itself. And so a lot of these things, like recommended daily intake or recommended daily allowances of vitamins and minerals, did you know that those were established in the 1960s and 70s?
Wow.
Just think about that. That's crazy because in the 60s and 70s, we didn't even know how to determine structures of molecules, really. The instruments that we use, like NMR and IR and HPLC, I won't geek out about that, but these instruments that we use to actually identify a molecule, they weren't discovered yet and they weren't even being used. So we had to use really rudimentary efforts and methods to try to figure out molecular structures. And so, because of that, we really didn't know how much to use. And so we did the best we could in the 60s and 70s to figure out, about how much we should use. But now, 55 years later, we know a lot more than we did back then. Just
True.
think about it. The human genome, we didn't know anything about the genome. The structure of DNA had just barely been discovered in the 60s by Watson and Crick. So now, 55 years later, we know how to isolate molecules. We know the human genome. We know how these molecules interact with the genome. We know the enzymes, the active sites that they target. We know signal transduction cascades. We know a lot more about how molecules work in the body. And so, because of that, the dosages, a lot of them have changed. Some of them have stayed the same, but a lot of them have changed. And so in our formulations, if you might see, whoa, you're only using 20% of the recommended daily intake, or whoa, you're using like 1,000% of the recommended daily intake. The amounts we're using are based on 2025 cutting edge science, based on how these molecules react with the body. And number two, maybe an ingredient based on 2025 science says you should use 100 milligrams, but we use 22 or 40. Well, why is that? The second part is absorption. You aren't what you eat, you are what you absorb. And so while guidelines might say you should use 100 milligrams of ingredient X, well, that guideline is based on the fact that science has shown that that molecule is only 10% bioavailable in the body. Well, one of the great things we do here at 3 is we have many different cellular absorption technologies. And those technologies can increase the bioavailability of these beautiful molecules. So if you're able to use a technology and make a molecule 4 times more bioavailable than the current molecule, then it stands to reason that you can use 4 times less of that molecule in the formulation. And that's what we do. The bottom line is we use the optimum amount of molecules based on their absorption, based on 2025 science, so that you're assured that when you take our products, you're getting the molecules at the right amounts to improve human health and wellness because it's the Goldilocks approach. You don't want too little, but you also don't want too much. Some companies
Right.
are flooding the body with just large amounts of medicinal molecules. And too much of a good thing can still be too much.
Right. Yeah. Well, okay, so then that begs the question. Sometimes I get asked about K2. For instance, people
Yeah.
know that you should have K2 with our vitamin D. Why does Vitality include D without adding that extra K2?
So the K2 in Vitalite is there, and it's actually naturally present in the green leafy vegetables. So when we were formulating Vitalite, we were analyzing the molecules in all the foods we were putting in, right? And spinach and Brussels sprouts and the other ingredients that we have in there. And what we found is that cruciferous veggie blend has 100% of the recommended daily intake of vitamin K2. So when you're taking Vitalite, you're getting good amounts of both vitamin D3 and vitamin K2. We don't put that on the label because labeling regulations, we don't need to put that there. And it was kind of awkward to figure out a way to put that there. And when it comes to regulatory guidelines in the 14 international markets, they're like, well, you shouldn't put K2. You can't put it up above because it's actually naturally occurring in the green leafy vegetables. We're like, yeah, oh, we agree. So the bottom line
Right.
is Vitalite has 100% of the recommended daily intake of vitamin K2 naturally occurring in the plants that we have in the product.
Right. So tell me about methylation then, with when we talk about green leafy vegetables and methylated ingredients, are the B vitamins in these products methylated? There's a lot of people that ask that because of something called MTHFR. And if you're listening, going, what is that woman saying? Just keep listening. But are these okay for people with MTHFR? Meaning, are they methylated B vitamins?
So, due to the advent of discovering the genome and the Human Genome Project, and since that time, there's scientists that are epigeneticists and geneticists that actually study the human genome, and they study how different molecules interact with the genes. And they've also found that although our genome is the same for all humans, that's what makes humans humans, there's some slight variance in the gene. It's kind of like a car model, a Ford F-150 versus a Chevy Silverado, right? I mean, they're both cars, they're both trucks, but there's just little nuances between them. And so when it comes to methylation in the body, there's a gene called MTHFR that some people have a harder time when it comes to methylation and breaking down different molecules. And so they actually benefit if vitamins and minerals are methylated. Now, natural vitamins and minerals are methylated. And we can go and talk about synthetic vitamins and minerals. But the bottom line, synthetic vitamins and minerals are not methylated. A lot of those B vitamins aren't methylated, and they're synthetic, so the absorption is bad, which makes the body's ability to work with these B vitamins diminished even more. So, our vitamin, when it comes to methylation, you want vitamin B12, you want vitamin B6, and you want folic acid to be methylated. And all three of those vitamins in our Vitalite product are methylated so the body can use them properly, even if you have that MTHFR genetic variant in your genome.
Perfect. All right, I've got just a couple more. Um, so this one I think will blow people away because I learned this and I did not know this. There were a lot of products in history that I've taken or even recommended that would say clinical studies. Well, what later learned was that there were clinical studies done on individual ingredients. So they were just pulling clinical studies on resveratrol. They were pulling a clinical study on glutathione. And that's not what you did here with the clinical study. So most companies rely on those ingredient studies, and they pose them as product studies, right? So tell me what this means, and can you walk through just the cliff notes of those studies at three and why they are so different than what most people are claiming as studies?
Clinical studies are a key part when it comes to improving human health. And it makes sense, right? If you want to know if something's going to improve human health or not, you run a clinical study where you give a supplement with all of its different ingredients. You feed it to human cells, you give it to people, you have a control, and you can figure out if this product is helpful or not. And it's really important because number one, before you make sure a product can improve human health, even before that, 1A is you want to make sure that it's safe for the body. And one of the things about the supplement industry is a lot of companies are actually using ingredients that are not safe for the body. And they're doing that because they want to get ahead. They're trying to get an advantage, kind of this gee whiz while we're using this new ingredient. An example is methylene blue. Methylene blue in different amounts has not been shown to be safe for human consumption. But that doesn't stop supplement companies from selling methylene blue. And we could talk about that later on. And that's conversation for another time. But when it comes to clinical studies, that's an imperative. And the really interesting thing is obviously, if you're developing a pharmaceutical drug, like I was doing early on in my career, you have to show clinical studies to show that it's safe. And that's why they have phase one, phase two, phase three, phase four clinical studies. And if all those look good, it can then progress to the next step of eventually becoming a pharmaceutical drug. In the supplement industry, clinical studies are not required. Companies don't have to show clinical studies. Isn't that crazy? Just think about that. You can just
Crazy.
randomly throw these ingredients together and you could start selling it. And we give it to ourselves, we give it to our loved ones, our children, sometimes other people. And it just blows me away that we're taking things that have not been shown to be safe. It's just mind-boggling. It's crazy. You don't need to run clinical studies in the supplement space. And most companies don't run clinical studies. Why? Because they're expensive. Clinical studies can cost anywhere from 10, 15, 20,000, all the way up to several $1 million. I've run a clinical study that was $5 million. They're really expensive. And if you're a pharmaceutical, excuse me, if you're a supplement company and you want to make money, does it make sense to spend $1 million on a clinical study if you don't have to? It doesn't. I've consulted for supplement companies in the past, and they've actually told me that they don't want to run clinical studies. They don't want to know if their product works or not. Because if your product doesn't work and you're already selling it and it's already out in the market, then what do you do? Right? So it's best to live in ignorance. And again,
Agree.
that just boggles my mind. And like Dr. Alicia said so eloquently, the other thing when companies say they have clinical studies behind it is they grab an ingredient. So let's say you have a supplement formula and you have 10 ingredients in that formula. And one of your ingredients is resveratrol. And we have resveratrol in our beautiful Eternel product, our purple pouch, that's helpful for supporting healthy aging, reducing oxidative stress, and it does a lot of really cool things. It regulates epigenetics. So, resveratrol. Resveratrol has shown to be clinically effective when you have 200 milligrams of resveratrol in a formulation. Now, most supplement companies, I haven't seen another supplement company that has 200 milligrams of resveratrol. So let's say I have 20 milligrams of resveratrol in my product. Well, why only 20? It's money. I want to reduce costs. I can't afford to have 200 milligrams of resveratrol. And I don't really want that. I just want to be able to show on the label resveratrol. And so you have 10 milligrams of resveratrol or 10 or 20 in your formula. And you say, well, this product has been clinically studied to help to support healthy aging. But the clinical study on resveratrol is 200 milligrams, and I'm using 10 or 20. So right there, there's a gap, there's a difference. Do you think that that study is going to hold up if I'm using 10 times less? It's not, right? It's not going to be effective. And the other thing is not only do I have resveratrol at a lower amount, but I also have 9 other ingredients. And when
Yeah.
you add 9 other ingredients, all bets are off if that activity, that clinical efficacy is still going to hold. So, what we do that makes us so unique and so different is we run our own clinical studies on all of the ingredients together, on what we call the finished good, the finished product. We run it on Eternel, we run it on Vitalite and Revive and all of our products. So, when we run a clinical study on that finished product and we show that this product can help with inflammation, anti aging, collagen production, and so forth, we are 100% sure that it's going to work because we've shown that. And that's a big deal.
It is. It's a really big deal. I always find it so interesting, those little nuggets that people just don't understand, and that's really the chaos that we're trying to get to. So, okay, I have one more, and then one like final question. Okay, what ingredients what ingredients does three intentionally avoid? So some people will ask me, like, are they gluten free? Are they dairy free? We don't eat, whatever that looks like. Can you talk a little bit about the freeze?
Yeah, so we use nothing synthetic because,
Yeah.
again, back to our pharmaceutical discussion before, synthetic molecules, while they're not inherently bad, they just don't sit well with the body because the body has grown up with plants, it's evolved with plants over thousands of years. And so the body knows how to break down molecules in plants. It knows where to put them. It knows how to use them. If molecules in the body have medicinal properties, it knows exactly where to send them. And so it's a beautiful thing. When you use a synthetic molecule, all bets are off. So we don't use anything synthetic. We use nothing experimental. Going back to what I said earlier, a lot of companies, they use experimental ingredients. An ingredient that hasn't been vetted for its safety and efficacy, they use it anyways because they want to get an edge up on marketing. They want to say, oh, wow, we're using this new great ingredient, blah, blah, blah. But there's no safety data behind it. There's no clinical efficacy behind it. Someone just randomly found it somewhere and they're using it. We don't do that. We use ingredients that have been vetted, that have clinical studies on the individual ingredient. And then, like I said, we run our clinical studies on the finished product as well. We use, things like parabens, preservatives, fillers. We don't use any fillers. That's another really interesting trick that we can talk about in the supplement industry is a lot of companies when they use really small amounts of cheap ingredients and they're putting it in a capsule, a lot of times those ingredients will only fill up a third of the capsule. Well, what do you do? Well, you don't want to sell a capsule that's only a third full. That looks tacky. That looks weird. So what do? You fill it with sawdust.
I
And
was
you
gonna
might
say
be like,
sawdust.
yeah. And you might be like, sawdust? Really? Absolutely. What is sawdust? Sawdust is cellulose. That's the material that plants are made out of. And so there's a lot of botanical ingredients that don't have large amounts of medicinal molecules. So it's basically just it's cellulose, it's sawdust, and they fill it with sawdust. They fill it with an ingredient called maltodextrin, which is basically just sugar. And so we don't do that. We avoid anything that can compromise the product. We use 100% natural. And most importantly, we use beautiful, powerful molecules in clinically studied amounts based on our own studies that are published in the peer-reviewed literature.
Right. Perfect. That wraps it up beautifully. No, nothing yuck, no gluten. All right.
That's right.
Last but not least, best time to take the products and can they be taken together or should they be taken together?
So the best time to take our products, in my mind, is when you remember to take our products because it's important, it's imperative that you take them every single day for proactive wellness. When we developed the Simple Six, what we did is we sat back and we said to ourselves, we are the molecular company. There's no other company that focuses on molecules because the body is molecular. So we sat back and we thought and we scoured the scientific literature. We looked at thousands and thousands of scientific studies and we looked at the thousands of hours we've spent doing research over the last many years and we thought to ourselves, what are the molecules that the body needs for proper function? And we made a list of all these molecules, hundreds, thousands of molecules. And then we said, okay, how are we going to include these molecules into products that are powerful, that are easy to take, that we can run clinical studies on, that have great absorption? And that's how we came up with these six products. So I actually say several times that we actually have one product. It's one product, it's a system that's broken down into six different delivery forms.
Yeah. Well, I think that's awesome. You've answered so many of the common questions we get out in the field. So I appreciate your time today. If you listen to this and you thought, I want to be a part of this, I want to have these science-backed products in my body, then reach out to the person who invited you. They can connect you, hook you up. I would say answer any questions, but I feel like you might have just answered all of them for everybody. And get started because the difference in all the things that he just said are what is making the difference in people. It's what's making the difference in the amazing changes people are getting, how they feel, how they function, how they're living their lives through all the background that he just said. He just took all that complexity and made it simple for us. You take them and we go on about our day and we get all that amazing background that he just shared into what we're taking. So thank you for being here, Dr. Dan. I appreciate your time today and circle back to the person who invited you here and share with them something that you learned. So have a great day, everybody.
Thank you.